All right, who's going to read the poll questions? Jane, are you doing that?
No, you're going to do that.
Okay.
All right, just let everybody in. Good afternoon, everybody. Thank you so much for joining us for our August webinar. Today, we're going to be talking about risky business, how unusual patient requests can lead to penalties. My name is Sarah Badaman. I am the CEO of HIPAA. I have with me today from the HIPAA team, Jane Bro, who's our Director of Sales, and Bethany Beatty, who is our Director of Marketing and is also our moderator for today. So a little bit of housekeeping before we get started. Everybody came in with your microphones and cameras turned off. When we get to the Q&A section, if you would like, you can either send us a chat message through the chat feature, or you can unmute yourself, turn your camera on if you want to, and we can have a discussion with you over your questions. All right. Another point is this meeting is being recorded. Everybody will have access to the recording later on. Probably, I don't know, Bethany, when will they be getting the recording? Bethany's on mute. So either tomorrow or early next week, everybody will be getting an email with a link to this recording of this webinar so that you guys can listen back to it. So without any further ado, we're going to go ahead and get started. All right. So we all know that we need to process these medical record requests in a timely manner. What we sometimes struggle with are these unusual requests that we get, such as requests from law enforcement or requests from personal representatives or folks with the power of attorney, and just trying to figure out exactly when and where to process and how to actually do it within a compliant manner can be quite frustrating. And if we're not managing how we are actually the process for actually releasing those records, it can actually get us into quite a bit of regulatory trouble. And by regulatory trouble, we also mean having a civil monetary penalty assessed. And so what we want to try to avoid at all costs is not only the frustration to our patients or other providers when we're not releasing records in a timely manner, but also avoiding that regulatory trouble. We also probably are very much aware that we have some increased regulatory activity. The Office for Civil Rights that oversees HIPAA compliance is extremely active right now with their Right of Access initiative. They have processed 19 civil monetary penalties in the past 18 months for hospitals and clinics that have not released records to patients upon request within the designated time frame. So this is actually a large number. 19 may sound small, but it's actually quite large, especially since this requirement to release records within a specific time frame has been in place since the beginning of HIPAA. So we're talking about all the way back to 2004 when we had to first start adhering to the privacy rule. So we really need to make sure that we're reviewing our processes and making sure that our medical records and HIM staff are trained on exactly what we need to do to release information upon request. So we're also, my goodness, I'm having a rough day with my language today. All right. So the OCR is not only levying these non-breach penalties, such as for the Right of Access initiative, we are also seeing a rise of technical assistance letters. So a technical assistance letter is when the OCR investigates a complaint and they send you a letter that says, okay, we had this complaint come through to us. Here's what you need to fix the complaint. And then they actually administratively close that case most of the time at the end of that technical assistance letter. But then they kind of put you on a list. And if they get another complaint from you, it is more likely to result in a civil monetary penalty. So it's extremely important that if we receive these technical assistance letters, that we're actually paying attention to them and not ignoring them because it doesn't come with any work on your side to do anything. We also know that the ONC is already receiving complaints from patients on information blocking. I know we have several clients that have received patient complaints, and the ONC has actually started already sending them letters on this. We do not know yet what the civil monetary penalty is going to actually look like. We know that it can be up to $1.5 million per incident, but because the OIG has not yet published their final rule on how they're going to do it, the ONC is practicing their regulatory discretion. And because nobody's actually received a regulatory discretionary penalty or investigation yet, we do not know what that's going to look like. But we do know that you do not want to be the first hospital or the first clinic that has a corrective action plan or a civil monetary penalty because of information blocking. So this is something when we're talking about the risks with unusual patient request or records request, we need to really be paying attention to information blocking and asking ourselves if the process that we have in place right now could be considered information blocking. I know that we've done a webinar or 20 on information blocking. We do have one of them recorded up on our YouTube channel. So I would definitely check that out if you've missed it so that you can get that information on information blocking because again, it is patients are filing these complaints today. And we had only until April 5th to comply with that. We also know that we have these new proposed modifications to the HIPAA privacy rule that are coming up. We don't know, there's been rumblings that this is going to be postponed until the end of the year next year, but we still have not heard anything definitive on when these new proposed modifications to the HIPAA privacy rule will be finalized, but we know that they're coming down the way. And so we're going to have to balance out everything that came with cures, which is information blocking. If you have substance use disorder treatment information, you have 42 CFR Part 2, which was modified with CARES. And so you need to make sure that you are adhering to cures, CARES Part 2 and HIPAA. And if these new modifications come down, you need to keep an eye on those as well, because the access to records will continue to expand. This is one of the main objectives of the OCR, as well as CMS, the ONC. They're looking to have more interoperability between providers, as well as additional access and freer access for patients to have their own data. So keep a look out for that. We also are experiencing some regulation overload, right? So everything I just stated makes processing medical records even more complicated. It's also why we have this desire to say, okay, if somebody requests records, they're going to fill out a form. We're going to verify every single thing. They're going to tell us why they need it, who it needs to go to. And we cannot do that anymore, no matter how tempting that is, because of information blocking. So, and you also have not just the federal regulations of cures, CARES, Part 2 and HIPAA, you also have to really look out for your state regulations to make sure that you're processing and allowing access to medical records within your state regs, right? So we have some clients in Minnesota, which is also where lovely Jane is from. And we can tell that the Minnesota state regulations are much more stringent than even information blocking, meaning that even to send records from provider to provider, the state is requiring patient authorization. So just because the federal regulation says something, you need to double check with your state to ensure that you are not breaking the state regulation, because underneath information blocking, there are these exceptions that will allow you to meet the state requirements as well. So that is something for us to definitely keep an eye out for. And then, of course, with all of these regulations, one of the biggest problems that your HIM and medical records staff is experiencing is which binder or which regulation do they need to look at in order to know what process to follow when they receive these requests. Now then, most of the time, the ones that are pretty everyday type of request, they're able to kind of process in their sleep. They know how to do it without any additional information or looking up the policies. But when we're looking at these unusual requests, or these requests that they don't get every day and that are a little bit more complicated in nature, this is where they really need to be able to understand very quickly which binder and which regulation to go to in order to process that request, because you do not want a right of access initiative finding underneath the OCR. You do not want to be found being an information blocker by the ONC. So make sure that your staff is able to easily figure out and determine how to process all of these records requests. So Jane, you want to talk about this slide here real quick?
Yeah, so this kind of ties into everything Sarah is telling you guys. This is a quick snapshot of her platform. Should look familiar to those of you who are clients, but this will really help you stay on track and making sure that all your policies are up to date and that you're following the current regulations. You know, even when information blocking went into play, we provided templates, new Cures Act policies, and if those hadn't been addressed by your organization, then you would have something at risk in your platform when you logged in. So we do have a quick self-assessment tool. You can see from a very broad view on how much you have at risk and how much you don't. And then we also have this hierarchy view where it can actually take you directly into the platform where you have something at risk. If your policies are not implemented yet, of course, that's a problem. If it has not been reviewed on the annual or every 18 months, whatever your organization decides, that's going to be an issue. And you also want to make sure that you are pre-planning reviewing these policies as needed. So of course, our platform helps automate that. And if you don't have a method already in your organization to remind you to be reviewing these policies, that's definitely something you should consider.
Awesome. Thank you, Jane. This is one of our things our clients really love because it helps folks stay on track with what their policies look like.
Right, especially if it's not your only role in your position.
Yes, and no HIM director has only one role, so it's a lot. Yeah, and so this is also where it can come into like really handy when we're navigating these pitfalls of patient rights and disclosure to providers, and knowing exactly what to release, when, where, and how. So knowing all of that information is super, super important. One of the biggest risks to hospitals and clinics right now is our patients are getting savvier. They know what their HIPAA rights are. They are extremely aware of them. They are also more active in reporting potential violations of their HIPAA privacy rights to the OCR, and the OCR is investigating those. Those go back to the non-breach penalties that the OCR is starting to levy, and it is because the patients are complaining that their rights are being violated. Patients are also demanding freer access to their records, meaning they want more information than what is just available inside of their patient portal. They're looking for access to all of their records, and you're going to see more and more requests from patients for that information. And until the patient portals with our EMRs kind of catch up with what the patients are demanding of us, our medical records and our HIM departments are going to be extremely busy in releasing this information to patients. On top of the good information that our patients are receiving and becoming more savvy on what their rights are and actually starting to exercise those rights, we also have patients that are getting a ton of misinformation. And a lot of them are getting this misinformation, unfortunately, from social media. We know Facebook, Twitter, and yes, even TikTok folks they're spreading misinformation on what HIPAA is, what it isn't, and what their rights are. And as a result, the OCR is kind of overburdened with investigating all of these patient complaints against you because patients don't know exactly what their rights are. So a good practice, even though it's not required of us, is maybe to post on our websites what the patient's rights are underneath HIPAA, more than just in the notice of privacy practices. I know that that's all spelled out in the notice of privacy practice, but if you're being kind of honest with yourself, how often do you read the notice of privacy practices when you go to the doctor or to the hospital? I mean, maybe if you're like me, you do, because like I geek out over that stuff, but not most patients don't. And so if you have a simple privacy bill of rights posted on your website, that could actually help put out good information for patients to understand what their rights are. So if they feel like you have violated one of their HIPAA privacy rights, maybe they'll go to your website, check it out, see what their rights actually are, and not report to the OCR. So we actually have several contacts at the OCR who were saying just that patients are complaining and filing a number of complaints about rights that aren't actually rights. So just be cognizant and aware of that. All right. So super high level, because information blocking is one of those things that is being complained about from patients, even if they don't understand, like, and some of it is misinformation. So information blocking is essentially a practice or a process or a procedure that restricts a lawful or authorized exchange or use of electronic health information, right? So if you are allowed to make the disclosure, but like underneath the law, but you have a process internally that is blocking or delaying that access, exchange, or use of electronic health information, then it could potentially be information blocking. Again, go to the HIPAA Track YouTube channel, check out the information blocking webinar if you missed it. It'll go into a lot more detail on what information blocking is, but patients are complaining that their rights are being violated underneath information blocking now as well. So make sure your staff knows exactly what it is so that they don't get bullied into believing a patient when a patient calls up and saying, you're blocking my information, that's against the law. So just get yourself caught up on what that is. One of the things that we all need to be aware of, and I know if you've heard me speak in the last 4 months or so, you've heard me talk about this. I think this has been in every single one of my decks over the past several months, is this concept of open notes that is underneath information blocking. These are not unusual requests to have. However, it is something that we're seeing a lot of folks struggle with, and that is a risk to your hospital or to your clinic if you're not adhering to the open notes process. This is immediate electronic access for these data points upon request. You cannot hold any of this for review. This is especially important when we're talking about laboratory and imaging reports. Those have to be reported, like are granted access to by the patient when requested. So if you do not have the ability to push this information to your patient portal, then you need an alternative manner to release this information that you and the patient agree upon, so that they can have this. You also cannot charge for electronic access to this information. So make sure that you're able to provide this in a timely manner. One of the things I do want to caution you about, because we have seen and heard tons of question about this, is if your portal already has a rule written where laboratory results are held for 3 days prior to being released, that could be considered information blocking. So make sure that you don't have a timeline that is set arbitrarily for all of your results or all of your notes before they get released to the portal. Make sure that there is a reason behind it, and the reason cannot be for the provider to have a chance to review it before it is given access to the patient. So again, these are not unusual requests. These are changes to the way that, as a whole, the healthcare industry is typically doing it. and it poses a severe risk to your hospital or to your clinic if you're not modifying your processes. All right, Bethany, we're ready for our first poll. Bethany is on mute. Okay.
Sorry, guys. So we've got our first question. Did you update your policies after April 5th? We have the choices. Our policies have been updated since the information blocking final rule was implemented. They've been updated, but I'm not confident they accurately cover information blocking. I don't remember the last time my policies were updated.
Yeah, the April 5th deadline is the deadline that CURES put in place for the information blocking rule to be in effect. So we needed to have at least reviewed our policies on or before April 5th. And if you haven't done so, it is really, really important that you do so now, and not just reviewing your policies, but also your processes. Make sure that you're talking to your HIM and your medical records folks so that you know that they understand what those rules and regulations are, and they've modified the process so that you're not caught being an information blocker. So Bethany, do we have the results of the poll, or do you want me to move forward?
Yes, so we've got about 13 people who've submitted their questions, and it looks like most people said that they don't remember the last time their policies were updated.
Yeah, so we really need to look at that. So one of the things I would encourage y'all to do this week, and I know it's Thursday, but you have the rest of the afternoon today and tomorrow, look and see when was the last time your policies were reviewed, and make sure that you are in compliance with information blocking. That is extremely important. And if you need information on information blocking, let Jane know. She would be more than happy to send you some information on how HIPAA chart can help you out. All right. One of the biggest things that we see when we're talking about these unusual requests that folks get is understanding the difference between a personal representative, a power of attorney, and an emergency contact. So a lot of times we understand what a power of attorney is. A patient brings in a power of attorney paperwork, and we know that that power of attorney can act just like the patient, not only for access to their medical records, but also for making medical decisions for that patient. And that is what a power of attorney is. So it is a little bit higher than, or a lot higher, because they're making medical decisions for the patient, than the personal representative. A personal representative is allowed to call and ask for access to the medical records, like know when the next appointments are, all of that information. And it needs to be specifically designated on like a patient has to authorize that person to be their personal representative. There also needs to be a way to terminate a personal representative request, right? So if somebody comes in and says, I don't want my mom to be my personal representative anymore, then you have to honor that. Whereas a power of attorney typically has an expiration date already on that power of attorney. And then an emergency contact is just that. That is who you are allowed to contact in the event of an emergency. A lot of times we get questions on this because our clients or other hospitals and clinics will call us and they'll be like, oh, like we had a nurse release this much information to an emergency contact, and it is way more information that should have been given in order to get in touch with the patient, right? Or in order to communicate information about the patient to that emergency contact. So emergency contact is a very limited amount of disclosure that is permitted. And we see a lot of little small breaches, less than 500, that don't get put onto the OCR wall of shame, but that you still have to report every year to the OCR when you are releasing unnecessary information to emergency contacts, or when you're elevating a personal representative to the level of a power of attorney. So make sure, again, that there is a clear understanding of what these 3 rules are, that you have the proper forms for folks to fill out or to submit to your hospital or clinic in order for the person to fall underneath one of these rules, and that your staff is trained on how to handle a request from each one of these types of individuals, and you have those processes documented and in place, because this is going to be, I have a feeling, something that the OCR is going to start to look in, as well as more and more hospitals and clinics are aware that when you do breach patient privacy on one of these issues, that it is a reportable issue to the OCR once a year. All right, so here's a power of attorney example. So we can just see, even if you know exactly what a power of attorney is, how complicated some of these releases can be, right? So this is an actual case that happened where a patient's brother had a power of attorney with an expiration date of July 1st. The patient's brother submitted a request for copies of his brother's records on June 20th. So before the expiration date of that power of attorney. But the HIM department took 2 weeks to process that request. Again, 2 weeks is perfectly acceptable. It's within the time frame that we're allowed. We're allowed 30 days. So therefore, the POA was expired when the request was reviewed. So what would your process be in this, right? Because there's not really a clear yes or no answer, right? This is an example that it depends on what your policy says on whether or not HIM is to release those records or not. Right. So in this case, the hospital did release the records to the brother that made the request, because they determined that because the POA was intact when the request was made, that the request was valid, and they released the records. The patient was super not happy when his brother received copies of his medical records after the POA had expired, and they did file a complaint. The OCR only sent out a technical assistance letter. However, it is something that we really need to be paying attention to. We need to know what our policies say, and we need to be able to follow them. This goes back to when I was telling you, like, which binder, which policy do I need to look at? And your HIM staff should not have to actually guess where that information is, because when these types of requests come into place, like if it takes me 2 weeks to get to that request, I only have 2 weeks then to process this request. Otherwise, I'm beyond my 30 days. And so if I don't know what to do, I can potentially be out of compliance with the time frame of which I'm allowed to process a request for information. So this is just to highlight the importance of having succinct policies in place, as well as process and procedures that my HIM staff can actually follow in order to be compliant. All right. So when we're talking about disclosures between providers, so provider to provider, in most cases, unless you're in the state of Minnesota, it is no longer just a permissible disclosure under HIPAA. It's now required underneath the information blocking requirement of the Cures Act, right? So any disclosure that's for treatment purposes from hospital to hospital, clinic to clinic, or any other treatment provider, it is required that you release that information in a timely manner without the patient's authorization. It is not required to disclose that or to obtain that patient authorization prior to disclosing the information in most cases, right? Now, then there are some exceptions, right? Like we have 42 CFR Part 2 is probably the biggest exception, where the patient has to specifically give consent for that release. But for most cases, the patient authorization is not going to be required in order to disclose that information. So again, not necessarily an unusual request, but it is something that we're seeing a lot of hospitals and clinics still struggling with. Even though Cures went into effect 4 months ago, we're still seeing delays with requests being fulfilled because hospitals and clinics are attempting to obtain patient authorization in order to release that information. You can no longer do that. All right, so some risks that you have when you are trying to process these patient requests is lack of policies and procedures lead to confusion, meaning if you don't have it all spelled out and you haven't thought of some of the more common unusual requests and you don't have specific procedures, your staff is not going to know exactly how to process those requests, and you need to go back and shore up your policies and your procedures or processes so that they know exactly what to do. We're also seeing fines, right? The OCR, again, extremely active with the Right of Access Initiative. And if you think you're too small to be investigated and levied a fine underneath this Right of Access Initiative, you are wrong. We work with a clinic that is a single provider with 2 employees that had a $100,000 civil monetary penalty assessed underneath the Right of Access Initiative. It is imperative that you train all of your staff that has the ability to release information or has the responsibility to release information on what the rights of the patients are, so you can process those requests within the given time frame, that so that you do not fall underneath this Right of Access Initiative complaints or investigations either. We also have improper disclosures. Because we're so afraid of this Right of Access Initiative and we're so afraid of information blocking, we've actually seen hospitals and clinic making improper disclosures or disclosures that are not permitted because they're trying to avoid the penalties that will come from information blocking or the Right of Access Initiative or violating another one of the patient's privacy rights. So it is really important that you walk that fine line between what is required and what is totally not allowed, right? And you are not making disclosures that are not permitted underneath the law. And then we also have to keep an eye out on these information blocking civil monetary penalties. They are coming down the way. All right, so breaches due to improper disclosures, again, are on the rise. A lot of times we're seeing these small breaches and they're going unreported. We need to start reporting those small breaches to the OCR. 99% of the time, those small breaches are not investigated by the OCR because there are a lot of them that are reported. But it is incredibly important that you are reporting them because patients are starting to report to the OCR. And so if the OCR investigates a patient complaint and you admit that it happened, but you did not submit it to the OCR on your annual reports, that could be a red flag for further investigation to the OCR. So again, it is extremely important for us to be reporting these small breaches, even if it's just the receptionist handing the wrong summary sheet to a patient, right? They get another patient's summary sheet. Patient brings it back. Oh no, that's actually a breach and it should be reported. The risks also extend to releasing information that should not have been disclosed, which is probably the most common type of improper of disclosure issues, right? So it's just like what I described right there, or staff that make mistakes in communicating with patients or over communicating. And if you live in a rural area working for a CA or an RHC, you know the issues with those small communities and the staff talking to one another. We also need to make sure that we know how to work through a breach so that when we have one due to an improper disclosure or any other type of breach, we have the correct resources and we're using the correct tools for our organization in order to be able to work through the breach, log it, and report it to the OCR within the necessary timelines. So Jane, you want to give a quick demo on the breach management?
Yeah, I think you have to stop staring your screen. All right, perfect. Can you guys see my screen, Sarah?
Yes, ma'am.
All right. So a lot of you guys may know how to, assess if something's a breach or an incident. In the event that you don't, we do have a tool in our platform. It's a quick automated tool where you can, respond yes or no. And then based off of the 4 factors, it will tell you the risk level of the breach or incident. So this is going to be helpful if you make this something like this tool available to your whole staff, so they can kind of, make decisions as well. And then you guys can actually go ahead and log it as a breach or an incident. So making sure that you collect all this information right away. Our platform asks you for all the information that the OCR will ask for. So you're going to want to collect all of that information and store it somewhere where it's easily going to be able to be exportable and submitted to the OCR. So while we have like a nice tool that you can actually see what kind of breaches you're having, what type of PHI, the location, what's really most important is to be able to simply export it to Excel and submit it when it is due annually. So if you don't have a quick electronic method in your organization, I would definitely look into a way that you guys can make that a little bit easier on your life. Oh, you're on mute, Sarah.
Alrighty now. Thank you, Jane. Okay, so the next thing we're going to talk about, see, can you guys see my screen? Awesome. All right, so Bethany, you want to give a poll?
Yes, so let me relaunch this. All right, so we're gonna go on to question 2. Do you find yourself in a time crunch to submit your annual breach report before the March 1st deadline? Our options are: I struggle every year to meet the deadline, I've always got it covered, no problem, or I didn't know I had to do that. So I'll give you a few seconds to answer this question, please.
Yep, this is something that's really important, right? And most years it's on March 1st. It's 60 days after the start of the calendar year that we have to report all of our breaches that are 500 affected individuals or less. The majority of all of our breaches are going to fall underneath this category, which are the smaller breaches. These are the breaches that we actually could be beneficial for us to report and walk through, because we can actually utilize them as a training mechanism, not only to the person that was responsible for the breach, but also for all of our other staff that have the similar responsibility or a similar role, so that we can prevent similar breaches in the future, right? So documenting and working through these small breaches, I know it can seem like it can be frustrating, but it could actually be a great training tool, as well as meeting the requirement of HIPAA to report those to the OCR.
Yeah, I would say that we find that our clients, the ones they see that they're logging as an incident, that gives them an idea of where there needs to be more training or possibly more periodic security reminders. It's almost like a test of how well you're doing on making sure your employees are well aware, if of course that was the issue.
Right. So we shouldn't be afraid of these small breaches, right? Like, they're going to happen. The OCR knows they're going to happen. Nobody's perfect. We need to actually just be doing what we're supposed to be doing and utilizing it as an opportunity versus as a weakness. All right, Bethany, what are our results here?
All right, so it looks like about half the people say that they didn't know they had to do it, and the other half say that they've always got it covered. So we're on opposite ends of the spectrum with that one.
Yeah, so yeah, make sure now you know you have to do it. So make sure you are. All right, so this actually is a great segue into our release drills and cheat sheets, right? So using these breaches are a great way, again, for training and everything, but it's also an opportunity for us to think through how we can do more real life training on release of information, right? So many times hospitals and clinics are giving the basic HIPAA 101 type training on how to release information, which does not give them the information that they need to handle unusual requests like that power of attorney example that we went through, or if they receive a subpoena or a court order or a police request for information. So doing drills of releases, of unusual releases like you see in the news or that you make up, could be a great training mechanism for you to ensure your staff knows exactly how they are supposed to be processing these releases, right? And it makes it a more interactive type of training to where they will more than likely like absorb and retain that information other than the click through computerized based learning modules that we all take every year to maintain our HIPAA awareness and doing HIPAA training. Right. But if we can do these types of drills before they experience one of these unusual requests, you are likely to not make as many mistakes and not have so many breaches to report to the OCR. And then also cheat sheets. Cheat sheets are so underrated. Not enough people are utilizing cheat sheets to help staff understand exactly how to work through a patient request for a record. Right. So if we look at the next slide here, this is an example of what a cheat sheet should look like. If you are a HIPAA client, this should be uploaded into your document section of the platform for you to be able to download, print, and post up for your staff. This is an incredibly helpful tool in creating other little tools or little note cards for your staff so they know exactly step by step what the process is to process a medical records request. This is a basic one, but if you can make them where they're more like going through some of the unusual requests as well, so they know exactly steps 1 through 7, what they need to do to process the request and document the request that like once it's finished being completed. You're going to be in a lot better place. I know every single time we've worked with a client that is in a corrective action plan from the OCR, 100% of the time, the OCR always suggests having cheat sheets. Cheat sheets are one of your best tools to help your staff understand what they're supposed to be doing. Because again, looking up policies and procedures every single time can be quite burdensome, especially if they don't know which binder they're supposed to be looking in. So cheat sheets, completely underrated. You need to have them. And if you ever have a breach from the OCR and are put onto a corrective action plan, I would almost guarantee you the OCR is going to highly recommend the use of these cheat sheets, as well as those training drills that go beyond just training videos and training PowerPoints that you go through with your staff. Having those drills is incredibly important. All right, so some key takeaways before we get into our Q&A, things that you need to be doing today. Number 1, train your staff. Your staff is your weakest link. Whether you're talking about releasing of information from the privacy standpoint, or if you're looking at cybersecurity issues as well, your staff are the weakest links, and they're going to be the one that cause you the trouble if you are not properly training them. You also need to make sure that you're reviewing your policies. You cannot train your staff if your policies are not up to date with the current regulations, because you're training your staff on improper ways of doing things. So make sure you're reviewing your policies at least once every 2 years so that you can make sure that they're on track, as well as any time that there is a change to the regulation. You need to be staying on top of all of that changing regulatory environment. Again, if you are a HIPAA client, you receive those via email, as well as with a little yellow alert bar at the top of your platform when you log in on the dashboard. Being aware of what the enforcement activity is also incredibly important, because that will help you to review your policies and train your staff, because you know what is being looked at and what the landscape of enforcement activity looks like, so you can actually avoid being the next one hit with a civil monetary penalty or corrective action plan. And lastly, it's very important that we align all of our compliance with our business objectives so that we are not in like on opposite ends of the spectrum there, or trying to fight with one another as we're implementing new business objectives. Make sure that our compliance is aware of it. One of the biggest things with the Cures Act that we're seeing in information blocking is IT and HIM kind of being at opposite ends of the spectrum on what needs to be pushed forward to the patient portal and how to grant that type of access. So make sure that you are working with all the necessary stakeholders, even if they're not in HIM, in order to develop out what your policies and processes look like. All right, so compliance is quality patient care. If you would like more information on HIPAA, please contact us. There is Jane's information. So Bethany, I know we have one more poll question as we wait for folks to chat us their questions or to unmute themselves.
Yes, we got one final question, and it's just a simple, are you interested in hearing more about the HIPAA platform?
All right, so now is the time if you have any questions on the information we went over today, to either put them in the chat box or simply unmute yourself and we will have a conversation.
And before any of you guys want to log off, if you don't have any questions, I just want to highly encourage you to at least answer this last question in our poll. And it'll just help us know how we can help you.
Okay, I'm just going to wait a moment to see if there are any questions. Because I know one of the biggest things that folks are really struggling with is still this information blocking and getting things going. And it is 100% not as complicated as people think that it is. It's we just need to make sure we're changing our processes and training our staff on what those new processes are. All right.
Mike Long, you've unmuted yourself. Did you have a question?
Yeah, a question in reference to the information blocking and one thing that was said earlier. So if you have patients who are smart enough to know the rules and submit a complaint against those rules, is ignorance a valid defense against an individual perpetrating something along those lines? Over.
Yes and no, Mike. That's a great question. So in information blocking, you have to know that it was information blocking. However, some of the things that the ONC has said in many of their webinars that they have given on information blocking is that if it's something that they've talked about a lot, like for example, the laboratory results or like just the whole open notes process, and you're blocking that information, or you're requiring patients to sign authorization forms for you to release the information to another treatment provider, the ONC is going to view that as information blocking. Even if you say you didn't know that that was information blocking or you were unaware, because the ONC has done such a great job with information blocking on pushing out the information to the general public and to the healthcare industry as a whole, that would not be defensible. Now then, if you blocked the information because you thought you were applying an exception, but you missed the mark on which exception to file under, that is probably more defensible. Again, we will know more about how the ONC is going to process those once the OIG has come out with their final rule and once we've had a few investigations underneath the information blocking, like the Prevention of Information Blocking standard or section underneath the Cures Act. Did that help, Mike?
Yeah, I guess what I come from a cyber defense world on the DoD side, and in some instances, the ignorance can be considered a defense, but in my roles, it doesn't normally lead to like $100,000 fine or whatnot. What I do know is I don't want to be the first to be investigated in reference to it. That would kind of suck.
It would be, yeah. But we're back, like, so if we remember back when high tech first came out and we had to first start reporting our breaches underneath HIPAA, we're kind of in that area with information blocking, right? Whereas we don't know yet because we haven't had anybody investigated or anybody put into a corrective action plan or levied a civil monetary penalty. So we don't know what that enforcement discretion looks like right now. And we don't know what it's going to look like in the future, right? And I think that it's going to be well into next year before we know what it's going to actually look like. But again, to your point, we don't want to be the first ones.
Sarah,
Exactly.
Mhm.
Oh, no, I was saying exactly.
Sarah, we have another question from Kimberly McGee. She asks, can we charge patients for paper records without being information blocking?
100%. So information blocking only applies to electronic health information, right? So if the PHI is in paper format, it is not EHI underneath cures, and you are allowed to charge for that. Be very careful because under HIPAA, we are only allowed to charge the actual cost of processing the request and for the actual cost of the paper and whatever supplies that it costs for us to do it. You cannot ever charge for the cost that it takes you to find their records. So make sure you know that and double check your state regulations because almost every state has their own special way of charging for paper records.
Thank you, Sarah.
You're so welcome. So are there any other questions?
Has everyone answered the poll questions?
So awesome, you
All
guys.
right.
All right. So thank you guys so much for joining us today. We really appreciate you spending this last hour with us. We look forward to having you again for our HIPAA huddle. Bethany, when is our August HIPAA huddle?
It is on the third Wednesday of August, which would be.
That's the 17th. I'm not trying to do math in my head, y'all. All right.
It is the 18th. So
18th.
sorry, guys.
Oh, that's Amira's birthday. That's when my daughter turned 16. So we're also going to have a HIPAA huddle so we can celebrate all together. So third Wednesday of every month at 1 o'clock Central Time is the HIPAA huddle. If you have any questions you would like to have posed on the HIPAA huddle, please submit them to Bethany. Her email is bethany@hipaatrack.com, and we will try to get to it on the HIPAA huddle. Otherwise, if you have any additional questions, please do not hesitate to contact Jane. Here is her contact information again. Her email address is jane@hipaatrack.com, or you can call her 314-272-2600. Thank y'all so much. Have a lovely rest of your day. Happy Friday tomorrow, y'all, and happy HIPAA tracking.
Thank you guys so much.